I would perform hand hygiene. Okay. Hello, my name is Adenari. I'll be your student nurse for today. Can you state your name and date of birth for me, please?
Maureen Alvarez, March 27, 2005.
Okay, so I would check her wristband. Okay, good. So we are going to be performing a physical assessment on Maureen. Okay, I'm going to ask you a question. Are you allergic to any medication or any latex?
No.
No, okay. If you could rate your pain on a scale from 0 to 10, how would you rate it?
0.
0, okay. I'm going to ask you a few questions, okay? What's today's date?
April 29, 2021.
Okay. Who's the president?
Joe Biden.
Okay, and where are you?
In a clinic.
Okay, so my patient is orientated ×4. Okay, for the general survey, when she walked in, her appearance looks appropriate for her age, and there's no odor on her or anything like that. Her body structure, there's no obvious deformities. Okay, for her mobility, she walked good. She was walking pretty well when she walked in. Okay, so good. I'm gonna start by assessing her head, her scalp. Okay, so I'm gonna check. Okay, she has good hair distribution. Her hair looks good, no lesions or anything like that. Checking her skin is intact. Okay, good skin integrity. Let's check her temporal. Can you take your glasses for me, please? Thanks. Check her temporal. Okay, good. All right, so that's good. We're gonna start with cranial number. We're gonna start with cranial number 2, which is optic. Okay, and I'm gonna use a Perla. So I'm gonna look at your eyes. Okay, so her eyes is a 5. Okay, and they're equal. Her pupil size are equal. Can you look away from me, please? And when I tell you to look at my pen light, I want you to look at my pen light. Now, okay, her eyes constricted, so that's a good thing. Next, I'm going to do cranial number 3, which is oculomotor. Cranial number 4 is trochlear. Cranial number 6 is abducens, and these are the 6 cardinal gazes. Okay, so I'm going to ask you if you can follow my pen light for me. Okay, and we have to make sure this is done slowly. Okay, good. So she did a great job. Next, I'm going to do cranial number 5, which is trigeminal. So I'm going to ask you to clench your teeth for me. Can you clench? Good job. Next, cranial number 7, which is facial. I'm going to need you to smile, frown, raise your eyebrows up, puff your cheeks out, and good. That's cranial number 7. Cranial number 8 is acoustic, and we're going to perform the whisper test. Can you cover your ear for me? Okay? And whatever I say, I want you to repeat back.
3, 2, 1.
Okay, next ear.
A, B, C.
Okay, good. So that was cranial number 8. Cranial number 9 is glossopharyngeal. So I'm going to ask you to swallow. Okay, can you swallow? Okay, so she swallowed pretty well. Next is going to be cranial number 10, which is vagus. Okay, so we're gonna I'm gonna need you to say ah. Okay, and I'm looking, and her uvula is midline, so that's good. Okay, next we're gonna do cranial number 12, which is hypoglossal, and I'm gonna need you to take your tongue out. Okay, and wiggle it. Okay, good. Now we're gonna do cranial number 11, which is a spinal accessory. So I'm gonna touch your shoulders, and I want you to put your shoulders up. We're checking for resistance. Good. Now I want you to turn your head that way for me. Okay. Okay. Good job. Next. Good. Great job. Next, we are going to do the carotid artery. We're gonna assess for the carotid artery. So we have to do for the carotid artery. It has to be done one at a time. So I'm gonna check her carotid artery. Okay, I can feel it. Okay, and I can feel it. And now I'm gonna listen to her, and we wanna make sure there's no bruit. And every time we do this, it's preferably to be done with the bell. So I'm gonna listen with the bell. Okay, take a deep breath. Okay, exhale. Okay. Next. Exhale. Okay, good. So that was for the carotid artery, so that was good. Next, we're gonna do the lymph nodes. First, we're gonna do for the preocular, which is in front of the ears. Okay. Then let me know if you feel any pain. No. Okay. Next is gonna be the post-auricular. It's gonna be behind the ear. Okay. Good. Next is gonna be occipital. Okay. Any pain?
No.
Okay. Next, we're gonna be doing submental. Okay. Lift your. Okay. Submental. Next is gonna be submandibular. Submandibular. Okay. Inoid tenderness. Okay. Next is gonna be the superficial cervical. Okay. So I'm gonna feel. Okay. So feel if we feel any. Okay. Now this is gonna be the posterior cervical. Okay. Sorry, that was wrong. Okay. Now is the supraclavicular. Okay. Okay, good. Now we are going to do the thyroid gland. So for the thyroid gland, we want to make sure it's not enlarged. Okay, so we're gonna do one at a time. Okay, and then the next. And it does not feel enlarged. So we're also gonna listen for a bruit, and I'm gonna also do the bell side. Okay, there was no bruit. Okay, so now I'm gonna do the skin turgor on here. Okay, skin turgor. Sorry. Okay, her skin came back well, so that's a sign of no dehydration. Next, we're gonna doing with the breath sounds. We're gonna do anterior and posterior. First, we're gonna do the bronchi, which is the trachea and the larynx, and this is gonna be high pitch, loud amplitude. Okay. And we're gonna listen for that, okay? Okay. Next, it's gonna be the bronchoviscular, and that's gonna be moderate. That's gonna be moderate pitch, and that's gonna be medium amplitude. Okay. So I'm gonna listen to that as well. Okay, good. Next is going to be the vesicular, which is going to be the peripheral lung sounds, and this is going to be low pitch, soft amplitude. Okay, so we're going to listen to that as well. Okay, good job. Next, we're going to be doing the heart sounds. Okay. So for the heart sounds, we have aortic, okay, which is the second intercostal space on the right sternal border. Okay, and for this we want to do before we do the heart sounds, I'm sorry, we're gonna listen to her posteriorly. Okay, so I'm gonna need you to look forward. Okay, breathe in and out. Again. 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 One more time. Okay. Okay, good. Now we're gonna listen to her heart sounds. Aortic. So I said aortic is the second intercostal space of the right sternum border. Okay, I'm gonna listen. We're gonna listen with the bell and with the diaphragm. First with the diaphragm. Okay. And now with the bell. Okay, next we're going to do the pulmonic, and this is the second intercostal space, left sternal border. Okay, and now the bell. Okay, good. Next is going to be the Erb's point, which is the third intercostal space, left sternal border. Okay. Good. Next is going to be tricuspid, which is the fourth intercostal space, and it's on the left sternum border. Okay, and now we're going to do the diagram. Good. Next would be the mitral, which is the fifth intercostal space, left sternum border. Okay. Good job. All right, good. And for her, I'm gonna stage for the apical pulse. We have to listen. We have to listen 1 minute for the apical pulse, and it'll be here. It'll be right here around under the breast. Okay, so that's gonna be that. And then for heart sounds, the first heart sound is gonna be loudest at the apex of the heart, and the second heart sound is gonna be is the loudest at the base of the heart. Okay, now we're gonna do for the upper extremities, for her fingernails. Okay, I'm gonna check for capillary refill. It has to be within 2 to 1 seconds. Okay, so she has good capillary refill. Okay, and I need you to straight arm like this for me. And I see no edema, so no swelling, and there's no tremor, so that's a good thing. Now I'm gonna have you grasp my hands, and tight. Okay, so she has a good muscle strength, and I'm gonna say it's a 5+. Now I'm gonna check for her brachial and her radial. Okay, her palpate. Okay. Right, that's brachial, and this is radial. Okay, good. I listened to it. Next, what we're going to be doing, assessing the abdomen. So in this case, I'm going to need you to lift your shirt up for me, please. Okay, so her, so it looks good, and and the color looks good. Her skin is intact. Okay, and I'm going to palpate for any tenderness. Okay, let me know if you feel any pain. No pain. Okay, good. Now we're gonna do for bladder distension. Okay. Okay, so we did the bladder distension, and her, I said, skin is intact. Okay, I'm gonna say now for the genitalia for the female, we have to check that there's no lesions, and I noted some hair, which her hair was fine, so it looks good, and there's no odor. And I'm gonna also state that her inguinal lymph node is on the groin, and her femoral pulse should be at 2+. It's going to be between the pubis and it's going to be between the pubis, and it's going to be on the anterior superior iliac spines. And for lower extremities, okay, can you raise your legs up for me? Okay, I see no edema and there's no tremor. And I would also check for capillary refills, 2 to 1 second. Okay, and her skin was intact. Okay, can you push for me? Okay, good muscle strength, which is a 5+. Okay, so we are gonna check now for the dorsalis pedis palpate. Okay, and for the posterior tibial pulse. Okay, good, 2+. Okay, so we are done with our physical assessment. I would put her call light within reach, side rolls up, and yeah, I would call light within reach, side rolls up, and that's the end of our physical assessment.